Right now, we're pleased to bring in Dr. Wendy Cole. She is the director of the University Hospital's Wound Center, and certainly with some really interesting research and latest developments in the treatment of bacteria and open wounds. And we know in talking on this show some of the effects of high-level diabetes cases where you have the open wounds and they won't heal. This is some breakthrough technology. And Dr. Cole, thanks for joining us this morning. Talk about putting together in the development of this research and this technology.
Well, first off, Ray, thanks for having me. And as you mentioned, this is very important. I think it's going to change, hopefully, the outcomes for a lot of patients that really do suffer with diabetic wounds of the lower extremity. So this device, it's called a MolecuLight. It's an imaging device that allows us to visualize the bacteria on the surface of wounds. Now, a lot of times patients that I see in my wound care center have had these open wounds or open sores for many months, sometimes up to a year or longer. So we know there's a lot of bacteria that harbor on the surface of the wounds. And what we're finding is that bacteria causes problems with deep tissue infections, sometimes bone infections, that leads to hospitalizations, the need for IV antibiotics, and then oftentimes, worst case scenario, amputation. And, a staggering fact that's really hard to wrap our minds around is that patients that suffer with a high-level amputation because of a diabetic foot ulcer have a higher 5-year mortality. So it means that they will die in 5 years, higher levels than patients that have prostate cancer or breast cancer. So this is a serious problem. So this imaging device hopefully will change those outcomes and prevent that from happening.
Wendy, the basic development here is this light is going to, I'm trying to simplify this for the listeners.
Right.
This light is going to be able to center in where there could be bacteria that maybe it wasn't identified in the past. Is that a correct assessment?
That's right. So with this imaging device, we use a violet light, so it's non-toxic, it's completely safe, it's non-invasive, so it means we don't touch the patient, we don't have to inject any dye in the patient, we just shine this imaging device with this violet light on the wound, and we can detect high levels of bacteria at lower levels than we were able to detect before. We can't see bacteria with our naked eye. We can take cultures, we can rub a swab on the wound and see what grows, and that can take 48 hours to 72 hours, and bacteria have to be at a pretty significant level to grow in culture. So we can actually detect these high-level bacteria on the wound that could be problematic sooner than we could ever before. So we could possibly put patients on antibiotics sooner. We could use topical agents that decrease bacteria. We could change the wound dressings or the frequency of these wound dressings so that we get these wounds to heal quicker and we have less negative sequelae in the long run for these folks.
Dr. Wendy Cole is with us, director of the University Hospital's Wound Center, talking about this breakthrough light therapy pertaining to open wounds. And for those, Wendy, that aren't in this sector, to say, of diabetes and don't understand the open wounds, talk about those patients that would qualify for this type of procedure.
Yeah, so we've been using it on any wounds that don't seem to be progressing really rapidly to healing. So we've noticed that if in about 4 weeks wounds aren't healing or healed, there's probably something going on within that wound that's causing them not to heal. And these are what we consider chronic wounds. So any wound that's been open for 4 weeks or greater, it's not, you cut yourself while shaving and, that wound heals within a couple of days. Those aren't the people we're focusing in on. These are wounds that have been open for 4 weeks. They're getting worse, and they're definitely not getting better. Often patients have a systemic disease like diabetes, or they have vein problems, they have lower extremity swelling, things that complicate healing. And those are the patients we're trying to target because we know that there are mechanisms that are off in their healing cascade. There's something that's causing them not to heal rapidly like we quote-unquote normally would. And those are the folks we're trying to help.
And Wendy, I think this is breakthrough technology, and you mentioned there a couple of minutes ago. This is life-saving technology when we
Definitely.
talk about it, treating these wounds. And so many times you see amputation, and unfortunately, those patients end up passing away
Right.
just because of the ramifications. This is the breakthrough technology. What do you think the future lies in this
Well,
type of procedure? Because I imagine this is the infant stage of this.
oh, definitely. And, that's why I love wound care. I'm a podiatrist by trade, but I solely focus on wound care and have been for the past 8 years or so. And so I've kind of dedicated my practice to finding new and innovative technologies. And that's why I kind of wear a researcher hat, too. So I think this is where we're going. It's more on the preventative side of medicine. So we're trying to detect problems with these patients and in these wounds before they lead to hospitalizations, needs for surgery, and then possible amputation. So this is kind of the tip of the iceberg. And I feel very fortunate because I am kind of in this space. I'm the first physician and only physician in Ohio using this technology. So it's kind of wonderful. I hope to see this grow and sort of become a staple in all health clinics that are treating ulcerations, especially those caused by diabetes. So I'm out there educating and clinicians as well as patients on what this can do. So
Wendy,
it's pretty exciting.
yeah, it is. And final question,
Yeah.
Dr. Cole, is put your podiatrist hat back on for a moment.
Hmm.
Getting back to all of this technology is for folks listening and you have the open wounds. Sometimes you'll say, well, that's just not healing. And you put some swab on it and a Band-Aid. Take
Right.
care of yourself and see a doctor, right, Wendy?
Yeah, the sooner the better, especially if you're a diabetic, because diabetics tend to be immunocompromised, which means their immune system isn't functioning as it should. And so oftentimes they'll have these open wounds that seem to be okay, but all of a sudden they'll kind of just blow up with infection. And so it's a ounce of prevention is worth a pound of cure. So seek treatment sooner than later, especially for those patients that are diabetic. And like I said, my clinic is located at University Hospital Ahuja, which is in Beechwood, and we run the wound care center there. But there's local wound care centers all over the city in Akron and Cleveland. So find your local wound care center and be evaluated.